Charles W. Hoge, MD, Colonel retired U.S. Army, directed the U.S. military's premier research program on the mental health and neurological effects of the wars in Afghanistan and Iraq from 2002 to 2009 at Walter Reed Army Institute of Research. He deployed to Iraq in 2004 to improve combat stress care and continues to work treating service members, veterans, and family members as a psychiatrist. He lives in D.C. and is my guest today because he's written a wonderful book called Once a Warrior, Always a Warrior, Navigating the Transition from Combat to Home, including combat stress, PTSD, and mTBI. Welcome, Dr. Hoge. How are you this day?
Good. Thanks for having me on your program.
Well, I'm delighted to have you here. This is a very interesting program for me to discuss with you. I'm a supporter of wounded warriors, and I really appreciate everything that our veterans have done. And one of my very best friends, you'll get a kick out of this, one of my very best friends is 93 and is a World War II Marine. She is so proud of that. In front of her condo, she has welcome Marines, and she has a Marine plate on her car. And another one of my friends, unfortunately, who just passed away in the last many months, was a WAF in the World War II. And her biggest claim to fame was that she walked in FDR's funeral procession. So, it's really interesting and amazing. But one of the things that you say in your book, and I thought this was kind of interesting, you said for this book, the terms warrior and veteran are meant to be interchangeable, with warrior being most often used. Do people get confused as what to call our returning service people, or what have you found?
Well, yeah, the term veteran is sometimes very specifically used in kind of a specific way for folks who've been in the military previously and maybe may be able to utilize VA benefits and so forth. But I sort of view, and then also service members who are still active duty don't refer to themselves as veterans, and yet many people refer to them as combat veterans because they've served in combat, even though they're still on active duty. So it can be a little bit confusing at times. So I just decided in the book just to use the term either warrior or use the term veteran broadly to refer to people who are both on active duty and had previously served in the military.
Well, now, since you're an expert in this, and we've heard so much about it in the media about PTSD, tell us a little bit about why or how some people come through their tours and come back to a very productive and vital life. Others have emotional trauma and difficulty in readjusting. And of course, this may have a lot to do with their injuries as well. However, there must be something that you see or understand in how some people get through it and some people just don't.
Yeah, and also people have both experiences. Sometimes they have a lot of challenges when they get home, but they also grow from those experiences and become very resilient people as a result. So it's really not an either or, but it's an important question, and there's a lot that go into why, for instance, in a combat platoon or a squad that goes out on a mission and engages with the enemy and maybe takes casualties. That's going to affect the whole platoon. There's no, everyone will be affected by that experience, but not everyone will go on to develop PTSD. The majority will not develop PTSD from that type of experience. And why do some people, the minority of people will develop PTSD from that type of experience, and why do some develop it and others don't, is sort of the $1 million question, but or the holy grail people have been trying to figure that out for a long time. But I think it has to do with a lot of factors, including, one's upbringing. If people have grown up in homes where there's been trauma or life challenges, or genetics can play a role, and then also the nature of the event or how personal it was, how close, for instance, like not everyone in the platoon, may have been the best friend of the person who, became a casualty, and but those who are closer to that individual will be affected to a higher degree. So there's a lot of factors that go into why some people develop PTSD and others don't. The other thing to bear in mind is that PTSD, there's a lot of misconceptions about PTSD, and if you look at it from the military perspective, everything that we label a symptom of PTSD is also adaptive and beneficial for a service member in a war zone environment. And so, you have to learn how to shut down your emotions, for instance, and be able to control your emotions in the operational environment. And yet when people come home, that may appear to their loved ones as withdrawal or detachment, which can affect relationships. But on the other hand, it stems from very adaptive, very beneficial functions. And this is really true for almost, all of the symptoms of PTSD are also reactions that are adaptive and beneficial. That's sort of the paradox of it in a way.
Well, is there a better recovery, or is it easier to work with someone who has a supportive family, or does the family not enter into it at all?
No, the folks who have stronger support systems from family or close friends do better on the whole, overall, than those who don't have that kind of support. There's no doubt about that. And of course that's, there's a lot of variability and everybody's experience is somewhat different. But overall, social support, the level of support that one has, both from the family and in the community, are very, very important. And also the support within for instance, for active duty service members within the unit structure. If there's a leadership and cohesion in the unit that supports help seeking when it's needed, that person will do better than if they're in an environment where the leader discounts mental health or views that as a sign of weakness. And that can lead to actually sort of compounding the problem. So leadership and cohesion, and then when you expand to the family, the family and the community, all of that is very, very important. And people who have supportive leadership, those soldiers do better. They have lower rates of health problems and lower rates of PTSD when they have cohesion, good cohesion, and strong support. And the same goes for the family.
Well, now, you also talk about brain injury, which I didn't realize that it had a mTBI. I didn't realize that it had a name. I've always heard concussions. I've heard brain injury. Really, I've never heard of the mTBI. But the question I have here is, we've heard so much lately about concussions and football injuries and all the young people. I think there's been 14, I think, young people, high school kids that have died from football-related injuries. Are the kind of concussions and brain injuries that happen in combat similar to the kind of concussions people like athletes get on the field? Are they two totally separate things? Are the healing rates the same? Tell us a little bit about that.
Well, that's also a very hotly debated topic. But by and large, from what we know, concussions on the battlefield mechanically are not that different than concussions in other settings, whether they're motor vehicle accidents or sports concussions, in terms of the blow or jolt to the head that causes one to have temporary loss of consciousness or loss or disorientation, for instance, are common things that can happen after a concussion. They're brief, and recovery is usually fairly quick, fairly rapid most of the time after those kinds of concussions. But mechanically, they may be similar, but the context in which a concussion occurs on the battlefield is very different. Many of the concussions that occur are blast-related, and very often when there's a blast that's that close to knock one unconscious, that's obviously a very close call on their life. There may have been other casualties that occurred at the same time in their unit, people that individual knows. And so, it's fair to say that the health, the detrimental effects, health effects of that experience overall is worse. And the more severe the concussion is, for instance, if there is loss of consciousness on the battlefield, those individuals have higher rates of health concerns when they get home. So there's a context that's important to take into consideration.
Well, now you also have a total section on all these various medications that are almost unbelievable to go into, but you also talk about how alcohol or drugs affect reactions. You hear all of that. You hear all that people, first of all, should not mix alcohol and drugs. You hear how alcohol can alter your state. We certainly know that drugs can do that. Tell us a little bit about your experience and how this has worked with the warriors that have been in contact with you.
Well, I'm a psychiatrist, so I do prescribe medications, but I don't think that medications are the be all and end all of treatment. I think that they can help at times, but there's a fairly good evidence that talk therapy, different types of techniques that are used in talk therapy, are actually more effective than medication, and there isn't necessarily any data to say that when you combine medications and psychotherapy that you get better results than with psychotherapy alone. So most of the patients who I tend to treat using psychotherapy, and then sometimes I use medications, which can be helpful as well. And, again, these things have to be very much individualized. In terms of alcohol and use of substances, outside of the medical system, there's a very high prevalence of alcohol problems and substance use disorder problems in folks who have PTSD and in combat veterans with PTSD in particular. And part of that is we sometimes use the term self-medication because a lot of folks, when they get home, they're physiologically so revved up from how their experience in combat and their training has affected their body has changed as a result of their experience, and so they're so physiologically revved up. They have difficulty sleeping. They wake in the middle of the night and can't get back to sleep. They feel hyper alert to threats. They're always scanning the environment for threats, and these are normal responses very often, especially after coming out of a war zone. But when you're that revved up, a lot of people will reach for alcohol to try to calm themselves down or to get to sleep or maybe to forget about some things that happened downrange. And that's really where the problems start, because when the alcohol becomes the means to get to sleep, then it ultimately will make things much worse. And so, I do a lot of education on that. I mean, it's important to keep that in mind. I'm not saying that alcohol is bad for everyone, when used in moderation, but it does really compound and make things worse. Even just a small amount of alcohol for somebody with sleep disturbance, it may seem to help to get to sleep at first, but then it makes it much more likely to wake up in the middle of the night and not get back to sleep. It also disturbs what we call the sleep architecture, which is, how the brain goes through different cycles, including REM sleep. It affects REM sleep, and it leads to a less restful sleep. So it's an issue that is important to talk about and keep that conversation going.
Well, it's interesting. I have to say, you've heard all the things about OxyContin and so forth, and I'm a three-time breast cancer survivor, and I've had 16 surgeries, and
Yeah.
I've been given OxyContin, and I've never taken it because I thought, my gosh, I could probably make a fortune selling all the pills that I have because I never took any. And my son said to me, Mom, really, you need to take